To address the issue of the Adani issue at the Jkia, and I would want to say in a very brief way that this facility at Jkia is a big installation. It's actually been ranked as one of the best airports in Africa. Has been managed since 1978 by Kenya Airports Authority. But then, 45 years down the line, really, the facility is not able to support the projected growth in passengers and cargo traffic. And this is not very good for Nairobi, being an international hub. So we have had embarrassments. You remember seeing photos of leakages because we used some tents that we put next to the runways. They had a 10-year period. It's now over 9 years, so that's why they are leaking. They cannot sustain. If you look at, for example, the Terminal 1A was supposed to be an arrival, but it was made into a departure kind of thing for domestic. So we really need to change. In addition to providing housing units, the AHP and SHIP aim to provide employment opportunities to Kenyans through both skilled and unskilled labor. And in that regard, currently, we have 160,000 youth and women who are employed in ongoing projects across the country. The target is to create over 1 million jobs through the affordable housing program for plumbers, electricians, masons, and stone cutters at the quarry and across the building and construction industry value chain as the government continues to roll out this initiative going forward. Cumulatively, there are about 100,000 housing units at various stages of construction across the country, and an additional 700,000 housing units are in the process of being built based on the projections of our budgets. And this includes 40,299 social housing units advertised on 25th of June 2024, the height of the Gen Z protests. We still were working, we continue to work. And this was done by the State Department for Housing and Urban Development. These units will also benefit the residents who were relocated from the flood-prone areas along the Nairobi-riparian area. So far, out of the 24 ongoing AHP projects, please note the number 24, 539,623 registered members of the public have saved a total of Kenya shillings 2,274,456,214, and a total of 6,411 houses have already been booked to date. So please book your house. The person who gets it first, 6,411 have already booked. The escalated construction program aims to increase the number of plumbers, masons, carpenters, and other assorted casual jobs on construction sites by over 50,000 opportunities. It is also expected that over 10,000 professional interns will be hired in the next year, starting with 3,360 who will join the ongoing projects in the coming weeks. Under this program, young university graduates will be hired through a job placement program akin to the public service internship program. So we already have this. Now moving into construction, we already have the intern doctors. So you can see we have the JSS interns. So quite a number. In fact, this administration will be known for having really re-engineered the internship program in the public sector like no other regime in the past. Regarding the use of local manufacturing resources, the State Department for Housing and Settlement has identified over 169 components that can be made locally. It has engaged the Kenya Association of Manufacturers, CAM, with a framework to ensure that they supply interior furnishings and finishes of such items like tiles, which can be produced locally. I think there's a very huge production in Kajiado, so that we can spur growth in the sector and promote the Buy Kenya, Build Kenya initiative. At the same time, the State Department has established a working relationship with artisans in the Jkia sector who are organized in groups and associations to supply doors and windows for housing projects. So the people in Jkia will have a nice time there. And when we say Jkia, we don't mean the Jkia the musician. We mean the people who are working there. Over 4.4 billion shillings, and also the weather is becoming more sunny, I think, going forward. So we want to have more people working. Over 4.4 billion has been ring-fenced for the Jkia and micro, small, and medium enterprises, MSMEs, in the ongoing construction projects across the country. This money will be paid to these MSMEs to construct, among other items, steel doors, windows, balustrades, curtain rods, and provide landscaping services to enable them to earn a livelihood. And in this regard, and following the model of the Open University of Kenya, which has over 3,289 students so far, there is also the recognition of prior learning, RPL, and the State Department for Housing is also implementing a groundbreaking recognition of prior learning program in the affordable housing program across the country, this is very important, because when you go to a construction site, you realize people who have experience are better than even those who have degrees. That's the truth. You find somebody who will be more knowledgeable than a graduate from a certain course, maybe engineering, because they have been practicing this for the last so many years. So this is very critical. Our masons, our fundis, so that they also get some kind of certification, now that we kind of value certificates here in this country more than even the real experience. And in this regard, therefore, we have successfully piloted the RPL in the AHP in partnership with NITA, where 213 artisans received an on-site assessment for RPL in their respective trades at the Kibra and Roiro AHP sites. This pilot project was fully sponsored by SHOFCO, which is an NGO. It's doing a very good job, SHOFCO. In fact, I was with some of the youth, doing some capacity building just a week ago. And the KCB Foundation, which also has done a very good work around Tujiajiri program. And the plans are underway to move towards a mass rollout and offer RPL to over 1,000 artisans across the country. So if you're there, you may not have gone to school, but you know something about building and you have been doing it, and you're in a construction site, please certify yourself. It really helps going forward. In this regard, also, the government is very keen on the construction of modern markets. We've been inspecting some of them with the President, in Mwaura, in other places as well. And this is under the Kenya Urban Support Program, which is a World Bank-led program, that is already devolved. And it is really an ambitious initiative by the national government in partnership with the county governments to provide mama mbogas and other hustlers with a proper environment to sell their wares. And it is important to say that we have not, and we are very committed to ensuring that whatever we promise mama mbogas and the border riders, that we achieve them, because those are the people whose rhetoric and narrative really resonated with Kenyans, and for this administration to be elected into power. The markets come complete with modern toilets, a generator, a resting area for breastfeeding women, Wi-Fi and other social amenities that contribute to providing a conducive working environment for local business practitioners in line with the Kenya Kwanza Manifesto. Let us now turn to the Social Health Authority. This is our second last issue that we are addressing in today's briefing. In the Better Plan, the government outlines key priorities, including employment and initiation of payments of community health workers who will form part of the primary health care system. It also prioritizes reducing the cost of treatment, harmonizing the terms of employment for all healthcare workers in the spirit of equal work for equal pay, and integrating preventive and promotive health services through the establishment of a multidisciplinary team. A primary healthcare approach is the approach that is envisioned in the Afya Bora Mashinani initiative. This initiative is in line with the key objectives of universal health coverage, which is to create a situation where people have access to the healthcare services they need, when and where they need them, without financial hardship. This has previously been enabled by NHIF through many initiatives under this outfit, but of course wrought with challenges. To overcome this, the government has introduced new legal frameworks to ensure smooth universal healthcare coverage, and there are three of them: the Primary Healthcare Act, the Social Health Insurance Act, and the Digital Health Act. So all of these are very, very important, and one of the key issues is to ensure, for example, that facilities improvement financing, the money is spent at source, If a healthcare facility is able to generate some user fees, then they also use a certain percentage of those monies to improve on the facility, so that we do not end up with dilapidated, infrastructure. Key among these frameworks is the Social Health Insurance Act, which repeals the existing National Health Insurance Fund, which was established way back in 1998, and replaces it with the Social Health Fund, SHIF. The Act provides for strategic purchasing of healthcare services under 3 thematic funds, including the Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency, Chronic, and Critical Illness Fund, attracting mandatory contributions and public funding models. The paradigm shift from NHIF to SHIF comes with enhanced benefits, including, number 1, the full digitization with minimal human interfacing, so that you reduce issues of corruption. Independent accreditation of health facilities by the Kenya Medical Practitioners and Dentists Council, so that you don't have people having fake hospitals doing so many surgeries than even the KNH, which has been witnessed. Use of National Registration Bureau biometrics as the single source of truth. As I've alleged, the Maisha number is very critical in this regard. So let's register, so that you don't have people using fake IDs. Expanded scope of the benefit package. Increased contributor pool and elimination of enhanced schemes such as those of civil servants. Dispute resolution mechanisms. Fair contribution for employed and self-employed individuals in both the formal and informal sectors, and enhanced equality and inclusivity, so that you even have packages for certain groups of people. The minimum monthly premium reduced from Kenya shillings 500 to 300, so that you can net so many people into the bracket, and coverage of all Kenyans, including the employed and the unemployed, old and affluent members of the society. It's a very egalitarian system. Health cover premiums with no exclusions, anchored on disease prevention, coverage for emergency care for entire populations, government coverage for the very poor and those with severe disabilities. And this is very important because they have, they're in need of constant medical attention, as provided for in the Persons with Disabilities Act number 14 of 2003. So this helps us to attain that. And also Article 54 of the Constitution. Informal sector contributions through annual premiums with opportunities from the Hustler Fund and cooperatives, and also the SHA card will also cover all health centers and dispensaries in addition to high-level hospitals. So you can get ill and then get into any health facility and you'll be served. Where will the money come from? Because that's the question people are asking. Number 1 is that there will be various fees that you will be able to be charged, for example, the user fees, reimbursement from SHA if you need to, and also appropriations of the county governments because of the over 400 billion that we devolve every year as a first charge of the consolidated fund, and also conditional grants by development partners and donations and gifts. So it's a very well-funded model that is sustainable. So the financing model is at the level of the health facility, but the Emergency, Chronic, and Critical Illness Fund will be publicly financed by the government from level 4 to level 6. So 1, 2, 3, free, 4 to 6 from the public funds, and then you can draw from your SHIF contribution of 300 and above, and then if you exhaust, then you come to the Emergency, Chronic, and Critical Illness Fund. So from level 1, 2, 3, SHIF will actually be working all the health benefit packages. So it's very, very clear. 1, 2, 3, SHIF is working, and of course, plus user fees if at all need be. But above that, then if you have to get more funding, then you go to the other, fund or Emergency and Critical Illness Fund. So what are the ways of contribution? Of course, basically it's about 2.7% of the income, so that we are all providing for both who are well-to-do and those who are more affluent, so that we are able to cushion the vulnerable populations. So we are all contributing into this, and it's a very good form of social protection, which will be determined by means testing. So I think that is very good. This is the real form of patriotism that we are calling upon Kenyans to have. just to note that everybody will be able to access these resources. So basically, you can register using star 147 hash or through the internet, and then of course it will be confirmed. And we are very happy to report as government that 861,101 Kenyans have already registered as of 3rd of September. And 9,729 health facilities have already been licensed and registered with KMPDC. And that includes 2,000 public facilities and 7,784 private and faith-based facilities. So already that is done. And of course, draft contracts have been prepared for health care providers. And also there is now a national validation process that has since been concluded by 30th of August. And so therefore, we are ready to go, in short. What we are waiting for is for a 1st of October deadline, and then we roll out. So please, if you've not yet done so, the government is asking you to do so. You know, Kenyans have this idea of going there for last minute. You know, there's a court issue on 20th of September, but we hope and pray that all shall be well, and we are calling upon everyone, you know, to do according to the idea that we need to really move forward. We can't have a situation where we revert back to NHIF in the absence of this framework that was really developed. We are actually 7 months behind, if not more, because we were supposed to have done this by 1st of March. That was the deadline. And that was a promise that His Excellency the President had made. But when you make a promise and then people rush to court and they derail the process, we all suffer, really. Once again, just to say that all civil servants are the ones we must lead from the front, register by 1st of October, and the Ministry of Energy and ICT and Digital Economy are really supporting a power, you know, and internet connections to all the health facilities. And then the Ministry of Education is supporting students' registration in schools. The Ministry of Interior also is facilitating the rollout of the Ngao network in terms of supporting this whole initiative. So we are very well coordinated. Finally, is to address the issue of the Adani issue at the Jkia. And I would want to say in a very brief way that this facility at Jkia is a big installation. It's actually been ranked as one of the best airports in Africa. Has been managed since 1978 by Kenya Airports Authority. But then, 45 years down the line, really, the facility is not able to support the projected growth in passengers and cargo traffic. And this is not very good for Nairobi, being an international hub, hosting 2 UN headquarters, similar to cities such as Geneva and New York, and Vienna and Rome. And there's a lot of increased economic activity. Remember, Kenya is the 3rd fastest growing economy in sub-Saharan Africa, after Nigeria and South Africa. Now we have a visa-free regime, yeah? Because we've knocked off the need for a visa. And we are trying to make Africa trade with Africa itself by leading by example. You need about 35 visas to travel across Africa. Now Kenya has knocked that out. The facility is only able to cover 7.5 million passengers, but now, last year alone, we covered 8.6 million, so we can cover even more, even 10 million, but we don't have the capacity. So we have had embarrassments. Remember seeing photos of leakages because we used some tents that we put next to the runways. They had a 10-year period. It's now over 9 years, so that's why they are leaking. They cannot sustain. If you look at, for example, the Terminal 1A was supposed to be an arrival, but it was made into a departure kind of thing for domestic. So we really need to change going forward, and that is why we need a strategic partner. So there's a proposal. It's still being evaluated, but I can say this without fear of doubt, that Adani Group has had a very good track record in India and other places in investments. And also they've also made a proposal to see how to refurbish and to create new electricity lines so that then we don't have the power outages like the one we had recently because of the fact that the current lines cannot really carry the load. That's why we have load shedding everywhere. You know, so that is something we need to look out for. And you'll be seeing more of this. You even see now Chinese will be taking over the Rironi Road, at least a proposal from the Chinese meeting, the president's meeting in China. So we'll be getting more and more PPPs and PIPs, so that then we have a way of refinancing our own development, because the issue of borrowing is becoming a challenge, and also the fact that people don't, I mean, there has been, like now with the setbacks of the finance bill, we really have a cash crunch in government. So these are some of the ways in which to beat these oddities that have confronted us. You know? So going forward, including the Nairobi-Mombasa Expressway, all of this, we will be looking for partners, including the whole corridor, the Lamu-Mombasa, Lamu-South Sudan corridor, all the way, so LAPSET. So we need to do that, because without that, ladies and gentlemen, fellow Kenyans, we will not be able to finance our development. And it's also because of that that we're asking you guys, please, the media, be more patriotic. Some of the newspapers are giving us headlines that are really unacceptable. And I really want to call out the people daily. I mean, that headline yesterday was really unfair, uncalled for. Even if you want to get traction, but have some element of restraint, so that there's some way in which people can trust you. I mean, it's not fair to state things the way they are. And there's freedom of speech and freedom of the press. I mean, this administration has been one of the most open to criticism, but it's also good to maintain professional standards and to ensure that then you don't go overboard. The government seeks to assure Kenyans that every step of any project that is initiated will go through thorough public participation, and it is to the best interest of Kenyans. Kenya itasimama, Kenya itainuka, Kenya itanawiri kwa umoja na uzalendo. Mimi ni Mkenya mzalendo. Je, wewe? Thank you very much.